With all non-essential businesses shutting down, local nonprofits are stepping up to take care of your community. We're discussing their efforts, plus a conversation with some of our congressional delegates. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstadt, Cashman Equipment, and additional supporting sponsors.
According to a recently released report, a record 3.3 million people filed for their first week of unemployment benefits. This comes about a week after both federal and state government declared states of emergency. In the wake of the economic downturn, Congress has been working long hours to pass a coronavirus stimulus bill. We spoke with both Congresswoman Suzy Lee and Congresswoman Dina Titus about the relief package. Congresswoman Suzy Lee, we have you here via Skype, and we are very pleased to have you here. Thank you so much for talking to us on Nevada Week.
Sure, thank you. Thanks for having me. It's been a very tough week, a tough couple of weeks for Nevada. I've been working hard making sure we're getting the resources that we're going to need to come out of this economic and health crisis. So happy to be here to share information.
Yes, and let's go right to that package we're talking about here, the economic relief package, $2.2 trillion right now. It just went through the Senate. Just to put this into scope a little bit, that's 3 times what the relief package was in 2008 during the recession. It is also 3 times what our national defense budget is. We are talking about an extremely large amount of money. What is the process now going through the House?
Basically, the bill passed the Senate yesterday. It's going to go to the House today. We're actually tomorrow we'll open it up for debate. The plan, I believe, is to pass it by unanimous consent, which would require a voice vote. If there's some disagreement over that, then we have 24 hours to get to Washington and expect to vote on it on Saturday morning.
And how confident are you that with unanimous consent the vote could go through, or do you think there might be some additional movement and need to go to D.C. and do the vote there?
Well, listen, this was a bipartisan bill. It passed unanimously through the Senate. This was something that had been negotiated for, over a week and a half. We passed the $8.3 billion bill and then the Families First bill. This is clearly a much bigger relief package, an emergency relief package, and so I'm confident. I mean, I'm on the Problem Solvers Caucus. I work with my Republican colleagues all the time. I was just on a phone call with them today, so I'm relatively confident that we can get this passed the House with unanimous consent. That being said, I'm prepared to get on a plane and fly back to Washington if I need to.
Let's talk about the biggest part of the package here is the over $500 billion now for loans and relief for businesses, but also states and cities. We talked to Representative Titus earlier. She used slush fund to talk about where this relief was at that point because there were no restrictions.
Right now, if you just look at the Senate Republican bill, it's pretty much just kind of a slush fund given to the Treasury Secretary without any accountability or any strings attached that guarantee that money will go to help workers and not CEOs. So we put out a list of things we hope they'll move into that bill, and then we can move forward.
Are you comfortable now with some of the restrictions that the Treasury Department has put onto this bill?
Yeah, again, this was part of the negotiations to make sure that we're not just handing out money without restrictions. There's restrictions on stock buybacks. Companies cannot declare bankruptcy within the first year. That was something, basically this Congress took the lessons we learned from the 2008 bailout to really focus this money where it matters most. I think the most significant part of this bill is getting money, first of all, cash payments to families, but also the incredible small business package that was here as well.
Let's talk about a city like Henderson here. This relief is going to larger businesses, also medium-sized businesses, also the state and cities itself. What's your expectation on how the money would be used? We're talking specifically about the business relief here in a city like Henderson.
Well, first of all, again, a big provision of this was the $250 billion to state and local entities, and that's yet to be seen how that gets doled out. But Henderson, the city of Henderson, is so incredible in the resources they provide their community. So making sure, and then when you look at the lost tax base that's happening because of the closed economy, making sure we're making up for those funds. But I really, a big part of this package is the $367 billion for small businesses. I mean, this is pretty incredible resources that's going directly, when you think about it, $350 billion across the country is about a month and a half of payroll expenses for small businesses.
And to give it a little more context here, let's talk about a city like Laughlin here. At least at time of recording, there are no positive COVID cases in Laughlin, but they are feeling the effects extremely just because of the gaming and tourism industry here and all the ancillary businesses that are supporting that in Laughlin. Let's talk specifically about the small business portion of this. How is that then going to just directly impact where Laughlin is right now?
Listen, this is the small business. Whether you're in Laughlin, Sandy Valley, Las Vegas, Henderson, if you're a small business and you were forced to close, you are eligible for loans that will help you pay your rent, your payroll, and keep you operating. I mean, think about it, $367 billion. Incredible federal resources that are going to make sure that we're not going to see widespread closings of small businesses. So, and not only that, the SBA has built in several flexibility components to this to make it so that local banks can help support them to get these small business loans out to people. My advice to small business owners is go on the SBA website. They have a lending matching program. Find out what qualified lenders are available, get the ball rolling. They could have applied for the economic package already while they were waiting. They could apply for a $10,000 grant that will get them through waiting for approval. And all of those packages will roll into the 7A, will roll into this package. And again, if they keep their payroll whole, those loans will be forgiven.
Yeah, that's a great point, Congresswoman Lee, that small businesses and on the unemployment side get approval now so those monies can come through and get to you a lot sooner. It's a great point.
One other point I want to point out is I've been asked a lot by people that, when they were forced to close, they laid their employees off and they're already applying for unemployment. So there's some misconception that small businesses don't believe that they qualify because their employees qualify for unemployment. That is not the case. There will be an exception for that as long as they rehire at a later date. So my advice to small businesses is if you laid people off, don't feel like you don't qualify for these loans.
Right. We already talked about unemployment. Let's talk specifically about there is an expansion and an extension of what and who unemployment will cover. Can you give us some more detail on that?
Yeah, a lot of unemployment systems in states across this country don't fully fund what people were earning prior to unemployment. So this additional $600, if you take it on average across the country, $600 per week would generally make people whole in terms of their unemployment benefits. And then Bill extends it for up to 4 months. We do want to make clear to people that if you are receiving unemployment benefits and your job has been offered to you or you've taken another job, obviously you're not going to be eligible for those benefits. So we're working hand in hand. First and foremost, we want businesses to remain open. We want employers to keep on employing their employees. Unemployment insurance is a emergency measure, making sure people are having the resources now. But we want to make sure those people get back to work to the businesses they were working for before.
Right. Priority number one being the business relief, priority number two being the unemployment. Except I want to bring in this gig employees here, Uber drivers that might see a huge loss in income right now. This is covering them, correct?
Yeah, again, this was a big part of the negotiations for this package, especially here in Nevada. We have, hairdressers, we have performers, we have Lyft and Uber drivers, people who have really reached, become self-employed. So all these small business provisions apply to self-employed and gig employees, as well as the unemployment insurance, which was a huge, huge win in this package, because traditionally these gig employees have not, and self-employed have not paid into unemployment, therefore we're not eligible for benefits. So
Right. Yeah.
we fought hard in our package, Families First, to make sure that we are providing the resources to families first, to people who were put out of work because of this health crisis. But most importantly, I got to reiterate that this is a public health crisis, and this economic crisis will only end when we end the public health crisis. So a big provision in a lot of these bills was getting money into our hospitals, making sure we're providing for free testing to the extent that available, which is still incredibly limited, which is unbelievable. But making sure that we're getting the resources to individuals that they can get the care they need. And of course, I'm going to make a plug to continue to wash your hands, practice great hygiene, distance, because flattening that curve is really about not putting a strain on our hospitals and our healthcare system.
Correct. Yes. And let's talk more just about that healthcare system. As you mentioned, there is funding in this bill, $130 billion to reinforce our hospitals. We talked to Representative Titus about this. She said it wasn't enough. She talked about potentially activating defense production here to increase the amount of equipment and supplies we have.
We'll be out of beds, we'll be out of respirators, ventilators. We're talking about taking parts of convention areas in hotels and turn them into makeshift hospitals. I think that also in the House bill is to have the president go ahead and operationalize that military bill, so we can do like in World War II, where we can start using our military and defense department to produce some of those needed requirements.
Do you agree with that? Do we need more funding in addition to this bill to make sure that we can provide the equipment that we're going to need here?
Well, listen, this bill put in a lot of resources. The problem with our PPE and our equipment is really a pipeline problem. We were literally, as a country, caught flat-footed. We have the ability to make we've instituted the Defense Production Act. It's just really we're playing catch up, and and who knows? There may be a fourth bill. To me, this is more of an emergency bill. There may be a recovery bill. I'm not really sure. And I'm personally focused on making sure that we're, looking at going forward, what the impact on, small businesses were literally forced to shut their doors, didn't really know what to do. We were caught with this public health crisis. And we're obviously seeing the results of not having enough reagent, not having enough masks or protective equipment for our healthcare or frontline workers. And so I think there will be a lot of work done going forward to make sure those stockpiles are not only available, but readily available where they're needed, which is really what we're struggling with across this country right now.
Right. I want to switch gears and talk a little bit about the community-based organizations we have in Southern Nevada. Obviously, you personally have a lot of experience in nonprofit leadership. Nonprofits are struggling like small businesses are. We've just had a conversation with the United Way CEO talking about some of their struggles there. But they also are filling gaps, and they're doing amazing work in our community right now. First off, let's talk about just the federal relief here. How can our nonprofit sector fill some of the gaps or help support what we are going to be receiving in our federal relief?
Listen, a lot of this federal relief is going to come through our state and our county, and making sure, we're going to be getting that and partnering with our nonprofits, especially those on the front line like HELP, Three Square, Legal Aid. I mean, those are incredibly important organizations here who are helping people struggle right now. So, but more importantly, the provisions, the small business provisions, the loan to grant provisions apply to nonprofits as well. And so nonprofits can apply for those loans, which will be forgiven with the condition that they keep their payroll. So that's been taken care of. I do want to point out for faith-based organizations, because a lot of churches run their own food banks. They have their own nonprofit entities. Those nonprofit entities of faith-based organizations will also be eligible packages. So, I feel that this is an incredibly widespread package. There's a lot of detail in it. Again, we're still learning as I'm speaking exactly what's in this, but to the extent that of what I know about what's going on in the small business package, I think that the Senate and the committees did a great job in trying to foresee all contingencies and account for that.
Yep. Congresswoman Lee, final question. You've already mentioned hand washing and social distancing as the two big tenets we should follow here. But what else should our viewership know? What else would you like to share with them?
Listen, this is an incredibly uncertain time. This is a crisis across our country. I believe that Nevada is strongest when we come together as a community and work towards one another. And a lot of these solutions to the problems that people are facing, whether it's access to PPE, whether it requires innovation on the ground. I've already seen incredible acts of community going on where people are coming together, figuring out how to deliver food. Some of our private construction companies, our gaming companies have contributed all their food to 3 Square. They've contributed masks and gloves and a lot of the equipment that they would use to prepare food. I've seen people start food banks in their garage for their neighbors. And so my message is that we will get through this. I'm excited that the House and the Senate have gotten together to put forward this package. Again, I ask people to reach out to my office. SuzyLee.house.gov is my website. Call my office anytime they need something. We're here to help. And we know that Nevada is stronger when we come together. We've been tested before. We were tested in the crisis. We were ground zero for the recession. We were tested after October 1st. And I think we came out of that stronger and better than ever. And I believe we will do that again. And so that's my advice to people is keep your chin up, work hard, take care of your neighbors, make sure you're calling on people who you haven't heard from in a while. And together we'll get through this.
Absolutely. Congresswoman Lee, thank you so much for your time. Really appreciate it.
All right. Thank you. Have a great day.
You too.
Bye.
We just spoke with our congressional delegates talking specifically about some of the small business relief and how that also is inclusive to the nonprofit community here in Southern Nevada. Now let's talk to United Way of Southern Nevada and talk a little bit more about specifically what they are doing in the community. Well, Kyle, thank you so much for joining us. We really appreciate it, even though it is via Skype. But thank you for being here and taking the time to talk to us today.
Thank you for having me, and thank you on behalf of all of Southern Nevada.
So let's start. I mean, COVID-19, it's something we're all confronting. It's not only a threat to our direct health, it's our livelihood, our well-being, of course. But through the community convenings that you've already done and some of the partnerships and everybody that you're talking to, who really is the highest risk population? What are their most critical needs right now?
Well, the highest risk, as we all know, has been defined by the CDC, and it's anyone. And I was doing an interview the other day. I said, you don't have to be 60. You could be a cystic fibrosis patient at age 5 and be at high risk. So it's anyone in our community that is at high risk, as defined by the CDC, for contracting illness. So, and
just right now, is there a specific population that you're saying that is more in need of just services that, state government, local government, or private institutions are not providing right now?
Well, we are, because of the pandemic, It's unlike anything we've ever experienced. We all know that. All the nonprofit community is coming together. United Way has convened them all. We meet on Thursdays at 2. We've also done asset mapping had each nonprofit do that, which is on our website at uwsn.org/COVID-19. So you can see where nonprofits are at work.
I had the opportunity to play around with the tool itself. It is a great tool. Can you give us just a really quick elevator speech of exactly what that tool is and what it is supposed to be doing here?
Yeah, it's like their resume. It's a nonprofit's resume. Here's what I'm doing. This is where I'm doing it. This is why I'm doing it. And this is what we need. And this is what we have to deploy. And this is the area of our community that we're working in. What's so important about that is that it helps the user see, the user in the community, and it helps substantiate the vital and important work that the nonprofits are doing. And please remember that the social sector is what props up the needs.
And what are the specific services that are provided on that map? Can you outline?
Everything from domestic violence to food, shelter, meal packages, to virtual volunteerism, which is a big thing now. I just was on the phone with UNLV. So it's everything that a person in our community might need or want to know about.
And I know it's called asset mapping, and there is an actual map, but that doesn't necessarily mean these resources, given that we're dealing with social distancing, need to be in your backyard to access. If I were to access the site and maybe I'm looking for mental health services, is there a way to just filter based on that and find the resources that I might be able to access?
Yes, there is. And there's also on our COVID-19 site, we'll give you resources and frequently asked questions. So remember, this is organic and it's growing and developing. So to your point, it's going to be changing. It changes minute by minute, quite frankly, Kip.
United Way in general has a long history of organizing and providing support throughout emergencies. United Way of Southern Nevada specifically has that as well. You mentioned donations. First off, what is United Way doing to kind of organize some of the donations and make sure that the money's being distributed the right way?
We have been tasked for many, many years by the federal government, now through Homeland Security and the Office of FEMA in particular, to disperse federal funds, and it's through a mechanism called the Emergency Food and Shelter Program, EFSP. So every year when we get our tranche of funding, which we usually do around October 1, we put out an RFP for nonprofits to respond to who meet immediate basic needs. So we are using that same mechanism of our vetted RFP responded partners to deliver the money out through the community, through those direct service providers that are nonprofits.
Gotcha. So because that process has happened so early then, so the providers that you have that money is going to have already been selected essentially, I'm assuming?
They have been. However, we are putting out, hopefully by the close of business tomorrow, an RFP that we've truncated a bit, made it not quite as arduous, so that other nonprofits who are in the basic and immediate needs can apply as well. And I'm a believer that if you're tried and true and you can prove it and you've been tested and you don't have any problem with reporting back the results monthly to United Way, then you will, in fact, if you're in the basic needs area, probably qualify as a nonprofit to receive some of this funding.
United Way has specifically announced the Community Response and Recovery Fund. Is this the fund that you're talking about then? This is the money that is being pooled that will then go to the service providers you already have in your network? It's
called the the Emergency Assistance and Basic Needs Fund, and it will stay up and active for as long as we need it, and it will go right out to those who need basic needs, again, with our nonprofit providers on the ground who will vet and require the certain documentation from the individual.
Can you give us an estimate of how much money is in that fund that you hope to distribute?
Well, at this moment, it's about the thumbnail about $350,000, but it's literally growing by the minute.
Final question, probably the most important question. If you are an individual out there that needs some form of services, we've outlined a lot of what those are on the show so far. What's the best resource to go to?
I think right now, the quickest and fastest way for anyone to look at it. You could look at our uwsn.org/COVID-19 website. There's tons of resources there. Don't forget, if you have cystic fibrosis or you have a lung disease or COPD, there are national and local affiliates here that you should, in fact, be in communication with. That is essential because they're going to be the first line of defense to assist you.
Gotcha. Well, Kyle, thank you so much for your time. Really appreciate it.
Thank you, and thank you for caring.
Well, thank you so much for joining us today. Now, for resources that we've discussed on this show, always visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week. Thank you so much.
My fellow Nevadans, please follow Governor Sisolak's direction.
As Nevadans, we must all work together to care for one another and to act with compassion.
By staying home, we can protect our loved ones and our neighbors.
And never forget that as Nevadans, we're all in this together.
Thank you, governors, for your lifetime love and support for the Silver State. If home means Nevada to you, stay home for Nevada. Visit www.nvhealthresponse.nv.gov for more information.